Hello everyone. Today for the Women's Health Talk, we'll talk about fibroids, which are like whenever a patient like come after sonography, they are very anxious about fibroids. Like they think there is this tumor and
Yeah. So the word tumor, I think it puts them in a panic mode.
yeah, they think it's a cancer
Yeah.
and they are very panicked about
Yeah.
it.
But then it's one of the most benign conditions, I would say. It's a benign growth in the uterus. And as I tell all the patients that, it's an incidental finding, right? You never knew you had it. For all you know, I go and get an ultrasound, even I might have one. So
Yes.
these are the most incidental findings we can see on ultrasound.
Yes, and if fibroids are small, they're usually asymptomatic.
Yeah.
But and they are a very slow growing tumor. They grow like 1 centimeter per year. Like they're very slow growing. They are not cancerous. They are not even going to convert into cancer. It's less than 1%. But they cause other symptoms if their size increases.
Yeah. So the symptoms are mostly related to position and size, I'd say. So if they're inside the uterus, changing the shape and size of the uterus can cause problems with fertility, problems with conceiving, menstrual irregularities, of course, excessive bleeding, painful bleeding. If it is outside the uterus and causing compression symptoms like issues with bowel and bowel movements, and so I think the symptoms are very different from person to person. That's why whenever someone comes with a complaint, it's usually they might not think that it's fibroid directly, and I guess once we go for an ultrasound, we get to know what is the issue.
Yes, depending on the location of fibroid, we usually decide for the treatment of fibroid.
Yeah.
If we are thinking about an infertility patient and which it is close to endometrium, we decide to take it out.
Yeah.
If it is more than 3 centimeters and growing bigger and bigger and causing all these pressure symptoms on your bladder and your bowel, then we take out the fibroid even if it's not causing any other symptoms. Yes.
And again, treatment can be conservative also, right? It's also managed by medications. And the main thing is it is an estrogen dependent tumor, right? So if you have completed your family and it's a small tumor not causing any symptoms, and you know that you are going to reach menopause in another couple of years, so it's anyways going to regress with menopause.
Your uterus shrinks in size. Along with that, fibroids also shrink in size.
Yeah.
So after menopause, they will not cause anything. Yes, they are completely dependent on estrogen.
And even the newer modalities that we have, the non-invasive uterine artery embolization. So we have other treatments also, which is not always surgery, right?
Yes. Then there's MRI focus and all that things which without surgery also we can tackle the fibroids. Yes. Expensive.
So it's not something that you have to worry about or panic that way. So the most manageable condition.
Most manageable condition, yes. And it will not change into anything else. It's a very stable thing. It grows very slowly. You don't need to panic.
Yeah.